Okay, good evening, everyone. It's 6 o'clock. I think we'll get started. Welcome back to the Canadian Concussion Center's webinar series, which is sponsored by LIUNA, the Laborers International Union of North America. My name is Leslie Bertan, and I'm pleased to be facilitating or moderating our webinar, which was developed for individuals that have suffered concussions, their caregivers, as well as healthcare providers. If you haven't been with us before, the first half of the session we typically will have an expert speaker. And the second half of the session is there for you to get your questions answered. And our sessions recur every other Tuesday evening. Just to orient you to, in terms of the Q&A, if you just sort of move your cursor, you'll see that there's a Q&A icon at the bottom of the screen. So if you have any questions for the speaker, please enter them there. There's also a chat where you can enter any, if you're having any technical difficulties, you can enter your message in there and Christian can give you a hand. Also, to let you know that all of our webinars are archived on the Canadian Concussion Center website. So if you miss one or you want to go back and see what ones we've had, you can go on there and watch them. And thank you, Christian. He's just put the link in the chat. Before I go any further, we always like to begin by acknowledging the Indigenous peoples of all the lands that we're on today. Even as we're meeting virtually, it's important to recognize the lands we each call home and reaffirm our commitment to improving relationships and understanding with local Indigenous peoples. From coast to coast, we honor the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. Okay, so I have already oriented you to the Q&A. We're just going to run a short poll. We always like to just get a sense of who is in the audience. It just helps us in terms of our planning. So I will just give you a second there. And so for this evening's session, I'm really pleased to welcome back Dr. Charles Tator. He's going to be presenting treatment of post-concussion symptoms related to screens at work, school, and play. Dr. Tator trained in neurosurgery and neuropathology and was chair of neurosurgery at the University of Toronto. He headed neurosurgery at Sunnybrook, Toronto Western Hospital and University Health Network. He was a founder of Think First Canada, a national brain and spinal cord injury prevention foundation, and Parachute Canada, a national injury prevention agency. He is a scientist in the Krembil Brain Institute. He held 2 research chairs at the University of Toronto and is an officer of the Order of Canada and an inductee of the Canadian Medical Hall of Fame and the Canadian Sports Hall of Fame. In 2009, he founded the Canadian Sports Concussion Project and then the Canadian Concussion Centre in 2015, both at the Toronto Western Hospital at UHN, specializing in patient care and research in concussion. He's the author of 447 publications in peer-reviewed journals and books, and is a member of several journal editorial boards. So with that, I'm going to turn it over to Dr. Tator.
Well, thank you for that lovely introduction, Dr. Rattan. And thank you, Christian Pedersen, for being the technical expert tonight. And from my speaker's biography, you can probably surmise that I don't sleep very often. and I really do like teaching and sharing what I know, especially with people who have had concussions. So this is my opportunity to unload some of my information, and hopefully some of it will be helpful to you in your journey of how to deal with concussion. And tonight we're going to focus on the visual problems that people with concussion experience. And as we'll show as we go along, a large part of the brain has a function of uh, being involved in vision, either in moving the eyes to the focus of attention or of interpreting the image, the color, the movement, all of that goes on in the brain. After it gets the messages from the eyes, all of those messages are interpreted and stored in the brain. So it's no surprise that visual symptoms or vision symptoms would be more accurate way of describing them. Vision symptoms are very common after concussion. Probably 95% at least of the 400,000 Canadians who are concussed every year in our country will have some vision symptoms. So they're very, very common. And this is the list that we find that is present in the majority. So what's called eye strain, double vision, blurred vision, photophobia, meaning sensitivity to light. So those are almost synonymous. And then photosensitivity, which is a little different in that it focuses on natural light, like sunlight. And having trouble with regular sunlight is a very common symptom after concussion. And then something that we have studied in our center and which you can appreciate, our center is interested in helping people as well as trying to make gains in our understanding of concussion. And certainly understanding these vision symptoms has been a major undertaking in our group of researchers. And we have been very involved in a symptom called computer screen intolerance. That's what we've named it. And it's really a syndrome, which means a collection of symptoms that can be described as computer screen intolerance, meaning you just can't handle being in front of a screen the way you could before there has been a concussion. And that's a symptom and syndrome that has affected a very large number of people with concussion. Probably more than 75% of people with concussion have this difficulty of working in front of a screen. Um, some people have called it cyber sensitivity or digital eye strain. So there's some fancy other terms. And the screens that can be that can cause symptoms are computer screens, even small cell phone screens, and TV screens, probably in that order. Computers are worst, cell phones are next, and TV screens are at the bottom, but still bothersome to many people with concussion. And in addition, there can be other symptoms as well. So it usually isn't just one syndrome or one symptom that concussed people have. It usually is associated with other problems like headaches and dizziness and trouble with sleep. And the sum of all of this is that it does either prevent you from going to work or going back to school shortly after concussion, but hopefully with the treatments that are available and the prevention techniques that we're going to discuss tonight, that you will be able to return to learn and return to work, because that's really the goal, to get people better as quickly as possible. So, symptoms that can be triggered by light after a concussion are many. So it can trigger headaches. And if you had migraine type headaches before, and as you know, before the concussion, and as you know, many times migraine starts early on in life. Like I had my first migraine headache at age 4, you can imagine how that frightened my mother when I woke up screaming in the middle of the night at age 4 with a terrible headache. But as often happens with migraine, as you get older, the headaches become less frequent and less violent. But then if you get a concussion, you can go all the way back to what they were like in childhood. So concussion can stir up migraine type headaches. Um, and the headache can be triggered by light, just as it is with ordinary migraine. You can also have a feeling of dizziness and nausea and a discomfort right in your eyes. And it can lead to mental effects like anxiety or even panic attacks if the images are very difficult to handle. It can disrupt your sleep cycle. So, all of these are part of what we call computer screen intolerance. So, it's a combination of all of those symptoms. And other people have recognized that after a concussion, you do get symptoms of sensitivity to light. And this is a survey conducted by an eyeglass company, TheraSpecs. I just took this off the internet. The company that makes a lot of eyeglasses surveyed what symptoms people have after a concussion, and this is a real telling survey. So going into stores or public places is a problem for so many people after concussion. And it's because of the lighting, especially fluorescent lighting, as will come. And this can affect the time that you spend with friends or during family activities, and certainly interference with work, interference with using a computer or smartphone or watching TV, and also can affect any outdoor activities that you are involved with. So this is an important aspect of concussion, dealing with the vision problems that can occur. And what types of lights cause symptoms? And this is in order of what's tolerated the worst or what's tolerated the best. So the worst are fluorescent lights. And so many offices are lit with fluorescent lights. And for example, our examining rooms at the hospital are lit with fluorescent lights. And a lot of people who come into those rooms immediately are affected. And we have to dim the lights for them because of the sensitivity to fluorescent bulbs. Now, you may not know this, but fluorescent bulbs do come in a less bothersome type, and they're called yellow fluorescent lights as opposed to the usual ones, which are bright white. And the yellow ones are less bothersome after a concussion. So ask the boss to change the lights in your office or ask the teacher at your school. They're a little more expensive, but not that much more. Flashing lights, like from a police car, can be very aggravating. Flickering lights, similarly. And the brighter the light, like headlights, nowadays are much brighter than they used to be. So driving can be a significant problem after a concussion. And then this issue of computer screens. And it's the type of screen that is used, and virtually all computer screens, all phone screens, all TV screens, and but not e-readers are LCD, which stands for liquid crystal display. And it's that type of screen that is most bothersome after a concussion, with computer screens being the most bothersome. The type of light is very significant in terms of which ones are causing symptoms. Now, daylight is probably the worst. Daylight has a full spectrum of colors, all the colors of the wavelength from the shortest to the longest. Blue light, in fact, is the most bothersome to people after concussion, and it's usually that bright, brilliant blue, which I call Microsoft blue because it used to be the favorite color of Microsoft. And it, in fact, is the most bothersome after a concussion. And we've already talked about the white fluorescent lights being bothersome. And bright is more bothersome than dim. Glare, if there's a glare or a shininess to the light, it is more symptomatic. But even low levels of light after concussion can be bothersome. So the type of light and the intensity of the light are factors. We did our first study of this in 2018, so 7 years ago or so. It tested the value of a new type of screen that was being marketed. It was a type of e-reader screen, which meant it wasn't LCD. It was a non-LCD screen, and it had no backlight or flicker. And it turned out to be much more acceptable to people after a concussion. So that's something you can put away in your memory, that an e-reader or Kindle or Kobo, as they used to be called, will be easier on your eyes because it's not an LCD type screen. And we examined one of these that was made into a computer compatible screen, and it was found that it did help. Our research showed that this non-LCD screen was helpful to people who had computer screen intolerance after a concussion. Unfortunately, it wasn't a panacea. It wasn't that great a finding because it had significant deficiencies of people, who are used to scrolling and multicolor screens, and it had a very small screen, and most importantly, it cost about $2,000 to buy this special screen. So it had a lot of shortcomings. It's still on the market, but it's not our favorite for all of those reasons. Our most recent research, which we just completed, in fact, it was the subject of the Master of Science degree that was just conferred on Chloe Busso, who is still working at the Canadian Concussion Center. And she successfully examined the value of a different type of screen. And this is what she did. She looked at a computer screen that did not flicker. And these are the people that were involved, a number of other members of our team. And these in fact are slides that I received from Chloe, and she showed these at her examination, all the symptoms that can be present with ordinary viewing. And I particularly liked this cartoon with somebody scratching their head and looking very sad indeed in this cartoon. But fortunately, there are available treatments. But this is what we were studying. How does light go from the eye here? And these blue cells are special cells that are in your retina that are sensitive to blue light. And research has shown that these cells go directly to a center in the brain called the thalamus, and the thalamus is the pain center. Every time you prick your finger, stub your toe, or go out in bright light, the thalamus is the pain sensitive part of the brain. All the pathways that lead from the eye and from the stub toe lead to the thalamus. And we found that in research that cells in the retina send messages directly to the pain center. So it's no surprise that bright light after a concussion causes not only discomfort, but actual pain in some people. And this is the mechanism that is thought to underlie that. And this diagram is also meant to show that light affects a large part of the brain. So all of these arrows are showing brain areas that are affected by light. And a large part of the brain is involved in interpreting color, interpreting movement, in focusing. And so it's no wonder that visual symptoms are very common after concussion. And part of the trouble may be these cells. And a lot of work is being done on these cells right in the eye that produce these pain symptoms. So this diagram just shows the work that is being done and has been done to try to deal with this problem of sensitivity to light. And another problem is the idea that you can't fuse images the way you used to be able to. So, in other words, our brains are capable of obliterating the flicker of fluorescent lights. That's what they do naturally. So, if you look up at a fluorescent light, before the concussion, it won't be flickering because our brains can fuse the image so it doesn't flicker anymore. After a concussion, the brain loses that ability to fuse flickering images. So you see it as a flicker. So headlights are aggravating because they flicker, for example. So we're studying that in detail to see if flicker is a reason for persisting concussion symptom called computer screen intolerance. So that's a big topic in our center. And the way we have studied it, and this is rather interesting, that now you can buy a flicker-free screen. 10 years ago, you couldn't. But now when you go to a computer store, for example, or TV screen store, you can say, I want to look at a screen that's flicker free. And most manufacturers are onto this. So this is something that's only become available in the last few years, that manufacturers are now making flicker free screens. So we studied whether that helps people after a concussion. And we got two screens that look identical. Like you can't tell one from the other. So they all look the same, but one is flicker free and the other flickers. And let me just go back. And the way that's done is through the flicker screen being a DC current, and the flickering screen is an alternating current. So, and it's very easy for manufacturers to put one type of current into the screen or another type. And that is something that we're recommending to people to try. So in our study, we had 47 people like yourselves who volunteered for this study. There were 13 males, 14 women. The average age was 39. The number of concussions that these people had was the average was 2.5. So somewhere between 2 and 3 concussions. And they had, a typical uh, causes, falls, sports and recreation, motor vehicle collisions, struck by objects, and violence. So a very representative group of patients with computer screen intolerance. And, you know, these patients, 70% of them had been able to return to work, but 30% it couldn't return. Their symptoms were so severe. Those that had returned were often on reduced workload. And here are their occupations, typical array of occupations that those patients had who volunteered for this study. Um, and I don't, and the amount of time they were on a computer, you can see that they were all fairly heavy computer users. Some of them, in fact, were using a computer 6 to 10 hours a day, like accountants, teachers, etc., were on the computer all day long. Um, and here's what bothered them. So 44 had of the 47 were bothered by fluorescent lighting, flashing or flickering lights, cell phone use, etc. So you can see they were pretty symptomatic people. And we did a study so that half used essentially the flicker screen and half used the flicker free screen. So it turned out that reading was much more aggravating than watching a video. So there were two tests that we did. One was a reading test, the other was just watching a video like of Mario automobiles. Some of you have probably seen it with your kids. And so those were the tests. Uh, and what we found was that the flicker-free screen was somewhat more tolerable than the flickering screen. So that has been added to our recommendations. The decision wasn't as clear cut as we had hoped, but certainly a sufficient number of people preferred the flicker-free screen as compared with the flickering screen, enough to make us feel that we should tell people to go to your favorite computer store or TV store, sit in front of a flicker-free screen for a half an hour, and especially try to read something off that screen, because reading elicits symptoms much faster than watching a scene, for example, on TV. And that's something that we have discovered as well, that when your mind is engaged, the symptom is intensified of intolerance. So that has become one of our recommendations, to try a flicker-free screen. We also think that you should go to your ophthalmologist to make sure that there's no uh, increased pressure in your head that is causing the trouble with your vision. So visit to your doctor or ophthalmologist. If you do wear glasses, you should visit your optometrist after a concussion, because for some reason, many people need a new prescription after a concussion. Your vision may have changed, and this has happened to a number of people. So you may need a new prescription. And then if that doesn't happen, you need to see someone like me or Dr. Tartaglia or one of the other doctors that um, focus on concussion symptoms. And, we understand the challenges that patients face in trying to select a doctor and get to the right physician and get to the right ophthalmologist, for example, to deal with their symptoms. And this is a cartoon that I often think about when we recommend patients to see more than one healthcare professional. But, you know, that's the nature of concussion. And that's the nature of the brain, that it is very challenging to deal with the multiple issues that can arise after a concussion. The brain is very complex and does a lot of things for us, and each may require a different specialist, unfortunately. So, the remedies today that we can recommend, we have a whole list of them. So, uh, and they can really come under the name of accommodation. So these are accommodations that you can ask for. Tell the boss or teacher um, that you need to avoid bright lights. And I put this right in here, right up front, that you may need to have an occupational therapist in your team to be able to stick handle some of this, especially with your job. That you may, in order to get back to work and make the return to work successful, you should think about asking for help from an occupational therapist. Some people need to avoid fluorescent lights, that they may not have a solution for the light type of lighting in their office. You can try to keep your glasses on if you need glasses. You may need to have may not be able to put them away. You may have to wear them all the time. You may benefit from blue light filtering glasses. Blue turns out to be the most aggravating color after a concussion. We have no idea why that is so. It's just the way the brain is built. And as I said earlier on, it may be that the trouble is actually in the little cells in your retina, that they may be especially bothered by blue light because they are activated by blue light. So any type of filtering of blue light can be effective, and the optometrist can be very useful in prescribing blue light filtering glasses. Lots of types of sunglasses are very helpful for people with vision symptoms after concussion. And we have found that the best color is orangey brown. So avoid black, avoid blue, um, avoid gray. All those colors are available in sunglasses, and some people buy the wrong color. Look for orangey brown. If you like Elton John, he wore orange sunglasses that made him look like a bug because those glasses encircled his eyes and blocked any ambient light from fluorescent lights, for example. So that Elton John type of bug glasses are especially useful, and you can buy those very inexpensively. They're about $25, and you can, and if you don't need a prescription, or some people even use the prescription glasses on the inside and then use those bug eye glasses on the outside. So wearing even two pairs of glasses can work. And the other thing that people aren't aware of is that you can adjust your computer to increase comfort. For example, you can change the color of your screen with this program called f.lux. So that's something you can download and apply to your screen. It's free and it works for many people. F.lux. And many people don't know this either, that virtually all cell phones and all computer screens have brightness settings that you can adjust. And then, of course, limiting screen time is what many people don't want to do, but they may have to do that for a time until they improve from their computer screen intolerance. Um, Use more paper and less screen time is another strategy, or using an old-fashioned e-reader. If you can read some of your documents on the e-reader, like the one that I showed earlier. Um, and then, this is the e-reader type of screen that we originally tried. And then this is the newer one, a flicker-free screen that is made now by virtually every screen manufacturer. And but don't buy it until you go to your favorite store and try reading text. As I said before, not just looking at pictures, but reading text on it for about 30 minutes before you buy it, and you'll know whether it is for you. So don't just tough it out and hope the symptoms will go away. Now, vision therapy, we are often asked about. It does not seem to work for those with computer screen intolerance. Um, Staying at home and not returning to school or work is not an option. We don't want people to disrupt their lives because of this symptom. Because if you try these remedies that we've talked about, you will be able to return to school or work. So, this is a moving target. Hopefully next year we'll have even more strategies that we can share with you. We are still working on it, and in fact, many of you have volunteered for our current study of this flickering problem. For example, that's one of the issues that we're currently studying. So I'm happy to start answering some of your questions. And I would like to personally thank Launa for allowing us to put on these webinars. They've been our sponsor for several years, and we're very grateful to them for continuing to sponsor us. So thank you very much. And over to you, Leslie.
Great. Thank you so much, Dr. Tatter. We have uh, a number of comments and questions. Maybe I'll start with a few questions first. I have had post-concussion daily headaches. It sounds like they're 5 years out, especially after being on the computer. Uh, the neurologist is treating it like a migraine, but I don't have traditional symptoms. What is the difference between a migraine and a regular type post-concussion headache?
That's a great question. Not easy to answer because many people who have concussion headaches never had migraine. So that is one set of people. Another set of people is those who are definite migraine sufferers, and very often migraine comes on at a very young age, although it can begin at any age. It's a particular type of headache. It usually has visual symptoms associated with it, like seeing scintillating scotomata is the medical term for it, which is like bright lights that aren't really there, or colored streaks. So there's usually some visual phenomena at the beginning of a headache. And then it's often a pounding headache with nausea, with sometimes with vomiting, sometimes with stomach upset. And almost always, there's a family history. So your mother had it, or your father had it, or your grandfather. In my case, I think I mentioned I was 4 years old when my first migraine happened, and one uncle, my father's brother, had severe migraine from an early age, and so I had it. And certainly bright lights brought on my migraine. If I was using the microscope, for example, for operating, that would be a trigger. Not every time, but it was one of the triggers for me. So bright lights for sure can be a factor. So don't dim the lights and take all the precautions you can to prevent exposure to the type of light that stimulates your headache. But most most importantly, we have made remarkable advances in the management of migraine. Migraine can be so much better treated now than, let's say, 25 years ago. It's remarkable how many drugs will be beneficial to migraine sufferers. It's seldom that we can't find a drug to treat migraine type headaches. And it's the same with concussion. If your headaches are migraine type, that's probably one of the best ones to treat. It does require a bit of effort on your part to seek out a neurologist who considers himself or herself a migraine specialist. So, migraine is something that the neurologists have developed terrific skills at treating. And pretty well every 3 or 4 years, there's a new breakthrough in that field for treatment of migraine, including the type of headache that we've been talking about tonight. So, very often, you would benefit if you have persisting concussion, headaches, and screen intolerance and visual symptoms. You should go to a headache neurologist. In Toronto, there's a half a dozen, and there's another at least 10 scattered across the province. So these people are extremely skilled and they have a whole armamentarium. Like even Botox. Like
Mhm.
isn't that amazing that you can inject Botox into all the pain sensitive areas of the scalp and some of the muscles that are affected by concussion that are giving off headache symptoms and can be really helped by Botox. Botox has been remarkably helpful to many people. Um, and that's been used now for many, many years. It's time consuming, it's expensive, but it works. And similarly, non-injectable medicines have also improved dramatically. Even in the last year or so, new anti-migraine drugs have been discovered. So if your concussion headaches are at all like migraine, you're going to get helped. Um, if they're not at all like migraine, we do have a whole bunch of medications that work as well. The one that I have prescribed for the last 10 years, this is an old drug, a repurposed drug. It was originally discovered for one type of problem, and serendipitously, it was found that it helps people with persisting concussion symptoms, and that is a drug called amitriptyline. And it does reduce the um, frequency of headaches. So it's a drug that you don't take for a headache. You take it to prevent a headache. So it's a little different. It prevents headaches, and you take it every day. Um, it also helps sleep. So it's a very good drug for concussed people. It's probably the most common one that I prescribe, and especially for those two reasons, if you have trouble with your sleep and if you have headaches after a concussion. So it takes a bit of time to figure this out, get to the right doctor, but there is light at the end of this tunnel, if you'll excuse the pun.
Yeah, thanks so much. And just for those of you that want more information on headaches, we have most recently, I think it was Dr. Claire Sando that we had, who spoke on headaches. So her presentation is videotaped and it's on our site. So she is someone you can look to for more information. We have a question about iPads. It's just what about iPads? I guess. Do you have any comment on iPads versus computer screens?
iPads are better tolerated than a regular computer. Uh, it's more like an e-reader, and it will help. But a lot of people who work at a computer find that it's just not versatile enough to have the iPad. But certainly the iPad has more functions um, than the e-reader that we tested in our trial. So yes, try an iPad. It's often not as symptom producing. Yep.
Okay, that's great. Brian is asking, so are LED screens less bothersome and are there worse or better refresh rates?
Well, LCD is liquid crystal display. LED, um, maybe you could tell me what is LED? Light emitting
Yeah,
diode?
that's what I was thinking too. Yeah.
Um, we haven't really tested LED screens to my knowledge, so I guess I can't answer that.
Okay.
I
Okay.
better mark that down.
Okay. Yeah, I'll make note of that. Um, Many concussion patients are having difficulty with the last app update. So I think they're referring to on, I don't know if this is just on iPhones with its liquid glass feature. How can we get cell phone companies to be more aware of these issues?
Well, you can put pressure on the companies. For example, this whole move to non-flicker screens has been because of pressure from clientele who have said to the companies that we have this problem with flicker. We recognize when I look at a fluorescent, like you can test yourself when you look up at a fluorescent light, do you see it as a solid light or do you see it like this? And people after a concussion say, yeah, it is flickering. They may not have noticed it themselves, but if enough people tell the companies that that is bothering them, then that's one effective way to lobby. But believe me, what we've seen with the proliferation of flicker-free screens is a dramatic indication that the companies want to be responsive to your symptoms. Like they're trying to make screens as comfortable as possible to have a competitive edge. And 5 years ago or so, you found one or two companies with non-flicker free or flicker free screens, and now virtually every company is making a flicker free screen because it's so easy to make them. They just use direct current instead of alternating current. But one of the frustrations is how little fundamental research has been done because before we started this in 2018, virtually nobody was examining the science of computer screen intolerance. But now we see quite a few other researchers in this swim, and journals and ophthalmology and optometry groups are much more attuned to these problems than they were a few years ago. So things have improved.
Great. Thank you. If headaches largely stem from the screens, are any of the drugs that are prescribed for post-concussion headaches going to work?
Um, that's a good question. There's such a variety of agents that are now available to treat post-concussion headaches. And I would say that it's unlikely that all of those drugs will also deal with the causes of persisting, all the causes of uh, uh, computer screen intolerance. So I think you're still going to have to use the strategies that I've mentioned, like using F-dot Lux or using orange type glasses over your regular glasses, turning down the brightness. So I think all of those strategies are still going to be relevant. Yeah.
Great. Thank you. We had a couple of comments from Anna and Denise. Thank you. Just saying thank you for your presentation, that it's affirming and provides some hope, I think, in terms of some other strategies that they can use. In your professional opinion, would you advise against vision therapy only for CSI issues or for any visual issues resulting from a concussion?
You know, that is one of the most complicated questions to answer. And we did have an ophthalmology advisor a couple of years ago who was an expert in his field, and he was absolutely against vision therapy. And I personally have had patients in my office who have gone through vision therapy, have spent $5,000, which is about the usual cost, and say that they were worse afterwards or they were no better afterwards. So people spent all that time and all that money and it hasn't helped. So it's definitely no cure-all. I We do have with us now Dr. Christine Dalton, who, when is she speaking, Leslie?
I think in the fall,
In the
like
fall?
it won't be in this current, yeah,
Now, she offers a modified form of vision therapy. She is an optometrist and an extremely skilled optometrist, and she feels that there are some forms of vision therapy that help. So we don't have a clear answer. Um, like everything else, trial and error is good, but it's very costly. Like it can cost, as I said, $5,000 to go through vision therapy. And if you don't know that you're going to benefit from it, it's a lot of time, it's a lot of money because it doesn't happen overnight. It's quite a rigorous number of strategies that you have to go through. Now, I do want to stress that optometrists have a role to play. It's not just ophthalmologists that you can go to, but it is optometrists, especially if you're already wearing glasses, if you have myopia or if you have distant vision problems, then seeing your optometrist is a good idea because just the concussion itself may have altered your refractive error. So your near vision may have gotten worse, or your distant vision may have gotten worse, and you don't realize with the passage of time that you need a change of glasses. They can also help you with blue light filtering glasses. Um, but please do try some of the simpler methods that I've mentioned, like turning down the brightness and changing the color. Color is a fascinating thing that different colors aggravate differently, but it is usually the Microsoft blue, that brilliant blue. It's like the blue sky on a nice, bright, sunny day. That turns out to be the worst for people after concussion.
Great. Thank you. We have a question. You mentioned head pressure increase with concussions. Can eye pressure increase as well?
Yes, it can, but rarely. And that again is something that can be tested by the ophthalmologist and by your optometrist, uh, especially if you are in the older age group that where things like glaucoma or increased pressure in the eye can occur. So a visit, to an optometrist and to an ophthalmologist are well worthwhile. You'll have to pay for the visit to the optometrist, but the visit to the ophthalmologist is covered by OHIP. But that's well worthwhile. It is surprising how many people need a change of glasses that will go part way to relieving the intolerance to bright lights and the intolerance to screens. So we do rely on those other healthcare professionals to get you through this.
Great. Thank you. Dr. Judith, I hope I'm saying this right. Dr. Judith Cobley said, thanks for all the excellent information. I have been investigating the flicker-free monitor for the past year. I love your suggestion to go to a store to interact with the screen prior to the purchase. I have been unable to find a local computer store that has one on the floor. I may need to travel. Could you share the reference for the last study you were presenting that was completed by your team? I don't know whether
You know
that's
what? You are asking a question that um, people often ask us, and the answer is unfortunately, until the thing is published, we, it's just not good to let it out because that may prevent us from getting it published. Um, and we do rely on a publication to inform everybody that this is reliable. In other words, you get something published, you nowadays you do need peer review. And peer review means that experts have looked at this and they find it acceptable. And if it's, in other words, if it doesn't get published in a medical journal, you can't rely on it. When we sent, I mentioned the name of the master's student, Chloe Busso, who worked on this for 2 solid years and now has spent another whole year virtually dealing with comments made by very expert reviewers on her paper. And my name is on that paper, and many of the members of our team's names are on that paper. And yet the reviewers had, I would say, 50 questions to ask, almost as many questions as have been asked tonight were asked of us when we submitted that paper. And just this week, we circulated the last version to the co-authors before resubmitting it to the journal. And I hope that our answers are going to be acceptable to those peer reviewers and that this will be a publishable document and you can have a look at it, but you'll have to wait another 6 months. But between now and then, we're happy to answer questions verbally. So if you have any additional
on.
questions, just send me an email.
Okay, we are pretty much at time, but maybe I'll just try and sneak in. We had a lot of questions. Is there any evidence to support using a sepia background or reverse color like white print on black background to help with tolerance when
Oh,
reading on a screen?
great question. I forgot to mention that. Yes, there is. Some people do better with a black background. Reading white type on a black background is a strategy that you could try. I should have had that on the list. It has helped some people, and it's very easy to do that on most modern computers. So give that a try.
Great, thank you. And Brian had just back to the LED, yes, light emitting diode. So that's exactly what you were thinking. Um, okay, let's do one more. Oh, and just to let you know, there's a couple of questions just about the presentation. So this presentation, it is recorded and it should be up on the website, I think usually within a week or so. Um, it will be posted on the website, so you can go back and watch it there. Um, Deborah is asking, what about red light therapy?
In my view, it just has not helped. So many people have tried it for their headaches, for their visual problems, for their vertigo. It just doesn't make the grade. I would say it's not worthwhile spending a lot of time doing that. No strong evidence that it's going to help. I don't think it'll hurt, but I don't, I'm not optimistic
Okay.
from
All
what
right.
I've been told by
Yeah.
other sufferers.
Okay. All right. Well, I think we will stop it there. We're already over time. Thank you so much, Dr. Tatter. That was excellent. And thank you, everyone, for all of the excellent questions. There will be a short survey coming your way. So if you didn't get your question answered, you can include it in your survey. Just be sure to provide some contact information, email, because the surveys are anonymous. But you can include your questions there. And we will be back in 2 weeks. So February 10th. We're going to be having Dr. Robin Green, who's a neuropsychologist, and she's going to be presenting on persisting cognitive problems. So thanks so much and have a great evening, everyone.